Hi everyone, it's Dr. Ozempa, and I want to talk to you today about fasting. And actually, this is going to be the first of a multi-part video blog series that talks about the different types of fasting, what they are good for, what diseases they can treat, why we would want to do this particular type over that particular type. So hopefully clear up some of the confusion surrounding fasting. Because certainly fasting is a really hot topic right now. There's a lot of interest in different fasting protocols. So, in general, I want to touch on a little bit about kind of the general processes of what's happening in fasting with each of these videos, but I also really want to hone in on one specific type of fasting. So for today, I really wanted to talk about time-restricted eating. And this is exactly what it says. In the animal literature, it's time-restricted feeding. In kind of the popular, press and in mainstream media, it's sometimes called intermittent fasting. But what it means is that you're fasting for at least 12 hours and you're eating for 12 hours or less. So most of the time people are fasting within a 12 to 18 hour window, and they're eating all their calories within a 12 to 8 hour feeding window or eating window. And I think a lot of us think that just intuitively that we do this, but really the studies that have looked at this really have shown that the average American is eating for about 15 to 16 hours a day. And certainly that's not ideal. If you think about the ancestral environment, we were probably eating most of our calories within a restricted time period, and it was probably during daylight hours. We certainly know that, metabolism, digestion are not as effective at night as they are during daytime hours. Insulin sensitivity is better during the day than it is at night. So time-restricted eating makes a lot of sense from that respect. Now, the animal studies have been really impressive. There have been studies where they've done time-restricted feeding on mice and given them kind of a standard diet that they give mice to try to make them fat to simulate a Western diet, and they've been unable to do that. But it's important to keep in mind that 12 hours of fasting for a mouse is not the same as 12 hours of fasting for a human. So certainly the human studies have shown effect, but maybe not as dramatic as the animal studies. And the other interesting thing for weight loss purposes is that when people eat all their calories within an 8 to 10 hour window, they may spontaneously reduce their calories by up to 20%, which will help with weight loss. But time-restricted eating has been shown to improve insulin sensitivity, cholesterol. It decreases inflammation and helps with weight loss. And of course, it helps with this larger picture of keeping your circadian rhythm in sync. So, if we talk about kind of what are the specific benefits of time-restricted eating, the main things that have been looked at are metabolic diseases with time-restricted eating. So looking at glucose levels, looking at insulin levels, and seeing a marked reduction in somebody's risk for something like type 2 diabetes, pre-diabetes, metabolic syndrome. So certainly there's a huge benefit there. And, if we look at kind of these fasting protocols as difficult to easy, then certainly this is the easiest protocol that somebody can implement. Usually the easier ones like this, the shorter fasts are done more frequently. So most people will do this every day or several days a week. And again, helps with weight loss, helps with insulin sensitivity. Certainly we hear this helping with sleep, helping with mental health issues as well. Again, probably more due to the circadian timing effect. So again, just to summarize, all calories are eaten within a 6 to 12 hour window. Usually most people within this time-restricted eating are settling somewhere between 8 to 10 hours as an ideal. And fasting outside that window is limited to non-caloric beverages. So black coffee, plain tea, water, things like that. So that's time-restricted eating in a nutshell. Certainly, if people are going to try that, I always recommend letting your doctor know that you're trying this. But in general, it's a pretty easy protocol to implement, and most people will tolerate it pretty well. So hope everyone has a great day. Take care.